Hi, welcome to the Power of Care Spotlight. I'm Larry Moliterna with Meridian Community Care, and we're here today with Sue Trimacco, who has been on our staff for a while and actually came on as a nurse.
Yes.
And we've discovered that you had another skill and that you were trained in providing yoga classes. You're
Yes.
certified. And we started off by just saying, boy, wouldn't it be something that we could use to support the work that we do here at Meridian? So we're really glad that you're here. And we want to talk a little bit about kind of what is yoga all about, and it really ties into our philosophy of working with the whole person, the physical health, the emotional health, and the spiritual health.
Correct. Yes, it does. And more specifically, some of the aspects of yoga, the mindfulness, do have to do with the spiritual. It has to do with the overall health, which you're speaking of, holistic health. And what research has recently shown us is that mindfulness actually can slow down the hind end portion of our brain, the amygdala, which has to do with the fight or flight response. So what we see with people that are having emotional trauma, whatever they may be experiencing, it actually slows down that ramped up portion of our brain and allows the frontal portion of our brain to become more active. It helps with attention span, it helps with our focus. So it really seems to help self-regulate in any situation.
Well, it started with some idea about with some of our clients, they would really be able to benefit from that and enjoy it, and they really have enjoyed it.
Yes.
Now we have our staff who want to participate, and so we're starting some classes with staff. In our work life program, which we work with over 100 businesses, we're going to start offering that service to them, and especially with the construction of our new building, which we're finishing up now, we have a room design that we actually will be perfect for the yoga classes.
Yes.
So help me understand, so for somebody who's thinking out there, why would it be for me? So for the average person out there, why would they be interested in doing yoga classes?
Well, I think for a number of reasons. For overall health, yoga improves our respiratory system, our circulatory, digestive, lymphatic system. It calms down the nervous system. And it has huge benefits for depression, for chronic pain, for just a number of things. The things that we commonly think of about yoga are balancing postures, core strength. Of course, yoga does provide those benefits, but some of the other things that it does that other exercise forms don't is some of the twisting motions are helping more of the internal tissues. They wring out the toxins. They generally kind of massage our internal organs. And it really slows down the central nervous system, so it's very calming.
So what if someone was out there and they said, well, I haven't really been exercising much over the last few years, I've gotten out of shape a little bit. Any concerns that someone might have about starting out with doing yoga?
Yeah, that's a very good question, and I always suggest that everyone checks with their doctor. But typically, most things we can really work around. There's many modifications, and a lot of yoga has to do with breathing exercises. There's deep diaphragmatic breathing that will just, immediately calm us. Most of the practices start with a very safe practice, warming up the spinal column, bringing the breath there. So
people can kind of go at their own pace. So
absolutely, absolutely.
Well, this is great. I think this is just another thing, another service that Meridian is trying to add to enhance the work that we do with not only our staff and our clients, but throughout the community. I think we'll start to offer this program a little bit more often. So what we'll hope to do is get a little bit more information out on the website about what we're doing with yoga. And I want to thank you for bringing that and introducing Meridian to this service, because I think it's going to be something that a lot of people are going to take advantage of.
Thank you.
Thank you, Sue.